In medical imaging, efficiency is everything. A foundational operational shift is coming, directly impacting your bottom line. What if you could cut operational costs by up to 30%? A new CMS rule makes this a reality. This isn't about cutting corners. It's using technology for virtual contrast supervision, now becoming permanent. We will prove that this CMS rule for virtual contrast coverage will drive a new era of streamlined imaging operations. We'll break down the rule, show the efficiency mechanisms it creates, and prove how it solves an industry challenge. So, what is this change? Effective January 1st, 2026, CMS permanently allows virtual direct supervision for diagnostic tests. This is not a temporary measure. It's a permanent part of the Medicare physician fee schedule, signaling a long-term strategic shift. This practice was tested and proven during the COVID-19 pandemic. It's moving from emergency solution to a new standard of care. This shift has strong backing. The American College of Radiology formally urged CMS to make this permanent for patient access and cost reduction. So we have a permanent, expert-backed rule. But how does this regulatory change actually translate into a more efficient imaging center? The primary mechanism is separating the radiologist from a single physical location. This allows for immediate, on-demand supervision. For multi-site imaging networks, this is transformative. A single radiologist can provide simultaneous oversight across multiple locations. This multi-site capability directly improves scheduling. Coverage gaps are filled, delays are reduced, and operating hours can be extended. By optimizing time and improving schedules, centers can increase their imaging volumes without a proportional increase in physician staff. These mechanisms sound good in theory, but what does the data show? Let's look at the proven impact on performance. Fact: virtual supervision delivers faster response times. A remote radiologist is instantly present, removing on-site delays. Virtual contrast supervision improves access for patients and creates a more predictable workflow for outpatient imaging centers, especially in rural areas. As a result, hospitals are already adopting this, capitalizing on regulatory support and better virtual infrastructure. Better staff allocation and less idle time are how virtual supervision cuts costs. Faster and cheaper is compelling, but the most important question is it safe? Some worry about removing in-person oversight. However, evidence shows the opposite can be true. Standardized virtual protocols backed by HIPAA, CMS, and ACR guidelines reduce variability and prevent negative care impacts. Recall the ACR's endorsement. They cited benefits without compromising safety. Immediate audio-video availability is a central safety feature. With safety addressed, consider the broader context. The U.S. faces a radiologist shortage, projected to reach 42,000 by 2033. This shortage makes the one radiologist per site model unsustainable. The question isn't just, can we be more efficient, but how do we maintain access? This is where the new CMS rule becomes more than a policy change. It becomes a strategic answer to the looming workforce crisis. The answer to maintaining access is using our current radiologists more effectively. Virtual supervision makes this possible. Remember the force multiplier effect? That mechanism isn't just about efficiency. It is about survival for centers in a shrinking talent pool. This creates a complete CMS-approved solution. It cuts costs, expands access to evenings and weekends, and helps fight physician burnout. Let's bring it all together. The 2026 CMS rule is not just an update. It is the foundation for a more resilient and efficient imaging ecosystem. It drives operational efficiency through better use of a radiologist's time and broadens the reach of the imaging center. When administered by an experienced virtual contrast coverage provider, it becomes the way to combat the radiologist shortage and secure patient access for years to come. The January 1st, 2026 effective date is approaching. Administrators must begin planning now to integrate this technology and retrain staff. This is not just about compliance. It is about competitive advantage. Those who adapt will lead the next generation of diagnostic imaging. Streamlined operations, expanded access, and a sustainable workforce. This is the future enabled by virtual supervision. Connect with a virtual contrast supervision provider today.